Let's talk a bit about, because there are lots of people out there, me included, who would say, well, what difference does a few slightly out of alignment teeth make? This is an issue that can have a lot of repercussions, especially as you get older.
Absolutely. One of the biggest driving forces for orthodontic correction, other than aesthetics and cosmetics, is the health of the teeth. And many studies have been shown when the teeth are misaligned, it's harder to keep them clean. It's harder to brush and floss them. The hygienists have a tougher time keeping them clean. And there's also been a couple of studies to show that with malocclusion, which is crooked teeth, the occurrence of gingivitis, periodontitis, okay, which can lead to heart disease and stroke, are more prevalent. So
really?
It's kind of a small cascade where everybody's instructed to floss daily. Unfortunately, we all are guilty of missing the occasional day, hopefully not the occasional week.
Yeah.
Okay, and when it's the teeth are crowded, it's a little bit harder to floss, and you're not getting everything out as you should. What happens is the gums become inflamed, and then that infection, the bacteria of the gums, can lead to a little bit of bone loss. And with time, and it's very gradual, periodontitis is a very gradual disease that really starts to take away the bone that supports the tooth, which can eventually lead to tooth loss, or like I said, there's been studies to show that it can lead to heart disease, stroke, pneumonia, even diabetes.
Really?
So the mouth is a pretty good overall assessment of just general health.
Yeah.
So it's one of those things, aside from just the aesthetics, that we want to keep it clean, and then the teeth should be functioning properly. The front teeth should overlap a little bit, much like scissors, and a lot of times some people they have what we call an open bite, where the front teeth don't come together and they can't really chew their food properly. So what that does is they have to take awkward bites of food, and it puts more stress on the back teeth, or perhaps even the temporomandibular joint, the TMJ, which can lead to other issues with relations to the jaws in the back.
Yeah.
So it's
it's more than just crooked teeth.
Yeah, and a lot of people think that's what it is. It's, I have crooked teeth, I need braces, and sometimes it is. Sometimes it's purely cosmetic, and that's unfortunately cosmetic reasons are sometimes what drives us to go see a hairstylist or other important health things that we value. And sometimes there's a little bit more underlying bigger issues that could happen down the road.
Okay. Let's talk about the length of treatment when you're using wire braces or indeed Invisalign. What sort of treatment length do you look at here? I know it's obviously dependent upon how much movement you need out of the teeth to put them back into proper alignment.
Absolutely. That's a very good question, and it's very case specific. With Invisalign, sometimes it's a 6-month treatment, or braces, sometimes it's a very small treatment. A lot of it has to do with basically where the teeth start and where they end up. And the more complicated the movements, or the longer the movement is, if the tooth needs to move, let's say 7 millimeters as opposed to 1 millimeter, the treatment time will be longer. The other thing with orthodontics, sometimes if the teeth are really crowded because the jawbone is too small, at times we need to remove teeth to make room for the rest of the teeth. So those treatments basically take a little bit longer because we've removed the tooth and we have to close the space to have a good end result.
Yeah. Let's talk about Invisalign and checkups, because of course with Invisalign you're essentially taking a computerized photo of the patient's mouth, extrapolating it to what it should look like, and then letting the computer put together the Invisalign inserts that you will wear, the clear inserts, through the period of time you think it's going to take to make the total correction here. What about checking up? Because obviously you, as the orthodontist, want to keep an eye on things to make sure that the teeth are moving the way they should be. How often do you have to visit your office once you start the treatments?
Very good question. So what happens is with the Invisalign trays, they're changed every 2 weeks. So the pressure will push the tooth to its new position. And then after the 2 weeks, you'll change to a new aligner that'll push the tooth to the next position, let's say from A to B, then from B to C, etc., etc. What we normally do is we'll see our patients once every 6 to 10 weeks for an adjustment or an appointment to make sure everything is tracking properly, and to keep a close eye on the appointments. And we do more or less the same thing with the braces as well. So the benefit of that is, we have patients that come from all over the city to see us because, you know, to come once every second month for an appointment 6 times a year is not a big commitment, a time commitment to get your teeth straightened. And this is, I tell people, this is a once in a lifetime task that you're undertaking.
Right.
So if it's a treatment over 2 years and you have to come 12 times or 13 times, let's say, it's quite small. It's a quite small investment of time.
And one of the good things that you mentioned to me, at least in my mind, of course, is that out at Orleans Orthodontics, you've got free parking out there.
Lots of free parking.
And that's
so
big. That's big for me, let me tell you. The way they're starting to charge for parking at almost all medical offices these days is absolutely crazy. So I guess when you're checking on this, you're essentially looking at the computer projection of where the teeth should be at, say, the 2-month interval, and comparing that to what you see in the patient's mouth.
Absolutely. So one thing that's important to know is when the impressions are taken of the person's tooth, and it's a CAD drawing of the teeth.
Right.
A technician basically works with us to get the teeth in their final position. So what happens is when we submit to Invisalign, they post online the models of the teeth, a virtual model of the teeth, if you will, for going from A to Z. And back and forth, I tweak and I basically give them the instructions on how I want the teeth to move. Because at the end of the day, I'm the orthodontist responsible for the finished product and how the teeth will come together and look.
Yeah.
So sometimes the emails go back and forth where they're very detailed emails telling the technician, you know, please move this tooth 1/4 millimeter left or rotate it, 10 degrees mesial in, or it's very technical in what we do. A lot of people think it's just take an impression, send it to Invisalign, and then the computer just spits out these trays. A little bit more is involved with the Invisalign process.
Okay. We're